But now let's go and stop and talk to Jai. Jai, what's going on, sir?
Hey, good morning to you, Taizo. Well, it is June 25th. Summer is officially underway, and it's kind of summer all year round here in Hawaii. Let's welcome in Dr. Shane Morita. He is a surgical oncologist with the Queens Medical Center. This morning we're talking about melanoma. First off, good morning to you, doctor. Obviously, we have raised the awareness of skin care, especially in sun, and especially here in Hawaii. It can be such a dangerous thing. Melanoma. Is that simply caused, that type of cancer, is that directly related to sun exposure?
You know, I think that's a good point. It's not all melanomas related to sun exposure.
Okay.
I think the awareness here in Hawaii is very good. There's a subtype, an entity called acromelanoma that affects the palms, the nail beds, and actually the soles of the feet. And actually Bob Marley died of this in 1981. Tend to be more seen in the minority population, so felt to be related to trauma or inflammation. So sun-protected areas, still melanoma possible.
How many folks will be affected by this in a given year in the United States?
In the United States, more than 75,000 patients will be diagnosed, and more than 9,000 will die this year, unfortunately, in 2012. In Hawaii, we see about 250 cases a year of melanoma, and anywhere between 15 to 20 deaths.
I think we have some images, and I don't know what order we have them in, but help me understand some of the things that you're looking for and what we're seeing here, because what we have here.
Well, this is actually a melanoma of the scalp, and what's interesting is this, the hairstylist actually picked it up and pointed out to the patient. And again, wanted to emphasize that melanoma we tend to attribute it not only with sun, but also the Caucasian population. We do see it in the non-Caucasian population. This patient was Filipino. What's
the primary means of sort of managing melanoma and survivability? Yeah, I mean, obviously it's scary. If you see something like that, you're frightened. But I would imagine time is of the essence, that you need to get on it.
Absolutely. Early diagnosis is extremely important. Most melanoma is treated with surgery, where we remove the lesion as well as a normal rim of tissue called a margin. Any melanoma that's deeper than 1 millimeter in general should get a sentinel lymph node biopsy, where the lymph nodes are ascertained to see if they're spread.
Okay, Doc, if you don't mind, stick around. We're going to answer some more questions in about another half hour, if that's all right?
Sure.
Thank you, Dr. Morita. Appreciate that very much, and it's something obviously that is critical, and we appreciate folks knowing about that.
Thank you.
All right, so to come on Wake Up Today, this, my friends, is a simple penny, just a penny.